Hello all, my name is Holly. I am a registered nurse. I'm here today at the Redwood County Men's Shelter to provide an educational presentation on diabetes. The knowledge obtained through today's presentation will allow you to be more aware of what diabetes is, how it is treated, and to give you the power to control it. Speaking with you today are multiple nurses from Pennsylvania: Laura, Morgan, Karlee, Joseph, Shane, and Colleen. Enjoy.
Hello, my name is Laura Bennington. I also want to thank you all for coming today and wish you a warm welcome. We are very appreciative of you taking time out of your day to come be with us and listen to our presentation. What we want to talk about today is the importance of proper health care, whether it be preventative health care before you have an illness or issue, care during an illness or issue, and proper follow-up care. Today we hope to familiarize you more with the disease of diabetes and some of the resources that are available to you. Now, as you know, you took a pre-test and there will be a post-test following the presentation. The purpose of these tests are to see how we did in presenting the material to you. They are in no way meant to make you feel like you don't know the answers. We want you to answer the questions honestly, but then we also want to see the progression of your answers after the presentation. That lets us know how we did in presenting the information. We have certain objectives today that we're going to work towards, and what that means is those are our points of focus that we want to talk about, we want you to learn about and be more familiar with. Throughout the presentation, we want it to be interactive. We want to have an open forum between us and our audience, so please feel free to ask questions, participate in the discussions. If you have a scenario, if something has happened to you or someone you know, please share, we'll discuss it. We just want you to feel comfortable and very open with us. One of the other objectives of the presentation is proper foot care and assessment. A major complication of diabetes is called neuropathy, and what that means is the nerves in your feet aren't working properly, so you could obtain an injury to your foot and not feel it. Some people develop ulcers on their feet and lower extremities due to the circulation being compromised by diabetes. So we want to show you and have you be able to demonstrate back to us proper assessment and inspection of the feet. Another big point today is identifying the symptoms of hypo and hyperglycemia. Hypoglycemia is low blood sugar. Hyperglycemia is high blood sugar. They both have different symptoms and different treatments. So we want you to be able to differentiate between the two so you know what to do. So if your blood sugar is low, you want to get something to eat, drink some juice. If it's high, you may take insulin or your medication. Also, we want you to be able to identify 3 local resources that are available to you. So whether it be at your health department, resources offered at the shelter, or other community outreach programs that may offer things like diabetic socks, proper footwear, toenail trimming equipment, things like that. And also we want you to be able to verbalize an understanding of diabetes, the disease, and be more familiar with that. Many people say they have sugar, but they don't really understand what that blood sugar level means. Diabetes is a very serious illness. It can lead to death, cardiovascular disease, problems with your heart or blood vessels, and also, as we spoke about, problems with your feet and lower extremities. And then at the very end of the presentation, there is a course evaluation that we will offer to you. This is to let us know how we did. We want your feedback. It's completely anonymous, so please take a few moments and fill it out and let us know how we did. We want you to be honest. If there's something you liked about the presentation, please let us know and we'll continue to do that in the future. And if there's something you didn't like or think we could improve upon, please let us know and we'll work on that for our next presentation. Thank you very much for being with us today, and please let us know if you have any questions.
So we're going to start with what is diabetes. Diabetes is a disease that results in too much sugar in the blood. There are many different types, but for this teaching plan, we're going to focus on type 2 diabetics. So in 2018, the American Diabetes Association said that 1.5 million Americans are diagnosed with diabetes each year. In 2015, it was said that 252,806 death certificates named diabetes as the cause of death. So there are a few risk factors that increase your diabetes risk. There are high-risk populations. Some of these include obesity, age 45 and older, African American descent, hypertension, also known as high blood pressure, and high cholesterol, and also family history. So there are effects of having diabetes and poor sugar control. The major effect is vascular complications. This is because fatty deposits form in blood vessel walls, leading to restricted blood flow in hardened vessels. This can result in other coronary artery disease, other cardiovascular problems, and stroke. Diabetes can also affect your kidneys. This is because the glucose damages tiny filtering units of the kidneys, resulting in kidney damage. Diabetic neuropathy is a long-term result where the patient has pins and needles. There's sometimes pain or uncomfortableness to touch, usually in your legs or your feet. Also, diabetes can affect your eyes. This is because there is abnormal growth or damage to the tiny vessels in your retina or in the back of your eye. Some symptoms of this or problems with this, floaters, issues with color, and eventually possibly blindness. Other problems caused by diabetes have to do with poor wound healing, low immune system, and diabetic foot ulcers. So poor wound healing occurs because there's poor blood flow, as we talked about, and that can lead to ulcers in the foot. Normally they don't end up being healed all the way, and this can be an ongoing complication, sometimes resulting in amputation of a foot, a knee, a leg. About 15% of diabetic patients do end up with foot ulcers. Also, because of the high glucose levels, your immune system can weaken, which results in opportunist infections. This can be either osteomyelitis from the diabetic foot ulcers or something just as simple as yeast, commonly in their mouth known as thrush, or even something as serious as TB or tuberculosis.
Hi, my name is Karlee, and I am here to educate on the effects of being homeless and being diabetic, diabetes management, and different support groups or resources to reach out to. First, we'll start with being homeless and a diabetic. The number one issue is non-compliance with medication, whether that be due to a lack of insurance, the cost of the medication, because it can get very pricey, substance abuse, or mental illness. Other issues are uncontrolled comorbidities such as hypertension, obstructive sleep apnea, fatty liver disease, and a higher risk for certain cancers such as liver, pancreatic, and bladder cancers. Unable to visit a doctor either due to lack of transportation or insurance, lack of proper fitting shoes, clean socks, and products for proper skin and oral care. Diabetics do have a higher risk of infection due to weakened immune system, nerve damage, and a decrease of blood flow, which in all leads to a slower healing process, and lack of financial availability. Diabetic management. Very important is glucose monitoring, which means monitoring your blood sugar. This can be done with a CBG or capillary blood glucose machine. Lancets, which you prick your finger with to get the blood to monitor your sugar, and testing strips, which actually go into the machine and allow it to read what your sugar is, and you base your medication or your insulin according to what those results are, whatever your regimen is with your doctor. Exercise, very important. It decreases your blood glucose levels and the risk for obesity, along with a healthy diet. Regulating your carb, your sugar, your protein, and your fat intake is very important also. Medication compliance, smoking cessation. Smoking is already terrible for the body. On top of being a diabetic, it causes your blood vessels to harden and narrow, which has an increase of heart disease. Proper skin and foot care. Due to nerve damage, something very common in diabetics called neuropathy, you have a decreased sensation mostly in your legs and arms. So inspecting your feet daily in front of a mirror is very important, keeping them clean and dry, going to a podiatrist to get your toenails clipped, and proper fitting shoes are very important also. Proper oral care. Gum disease is very common in diabetics, and this could lead to high blood sugar levels. So being educated on the proper brushing and flossing techniques is important. Going and getting proper oral exams done, and you can actually find resources that can donate toothbrushes and toothpaste and floss, so you can keep up with oral exams on your own as well. Support groups and resources. A couple, American Diabetic Association, which is huge, the National Healthcare for Homeless Council, and Partnership for Prescription Assistance. Now, these three resource groups can help you identify areas that can give free eye exams, podiatry exams, and physicals in general. Identify resources for clean socks, shoes, toothbrushes, and glucose monitoring systems, which, as I mentioned before, is very important with managing your diabetes. Thank you.
Welcome to today's presentation. Thank you for joining us. We're now going to get into the interactive portion of the presentation and do some activities. But first I want to highlight the handouts that we gave you. The first one, titled The 411 on Prediabetes. I just want to highlight what exactly prediabetes is. It's a blood sugar in the body that's higher than normal. And that's right there in section number 1 under where it says, what is prediabetes? I also want to draw your attention to the section titled, Who Gets Prediabetes? Some of your risk factors for prediabetes is being overweight, being inactive, age 45 or older, a family history of type 2 diabetes, a history of diabetes during pregnancy, being a member of certain races, i.e. African American, Hispanic, Native American, Asian American, or Pacific Islander. How we can control some of that or mitigate that risk factor? The keys are eat healthy, exercise, and maintain a healthy weight. The next handout I want to draw your attention to is entitled Getting to Know the Signs of Hypoglycemia. What is hypoglycemia? Hypoglycemia is lower than usual blood sugar in the body. On that handout under signs of hypoglycemia, you'll see that some of the signs and symptoms are shaking and trembling, sweating, dizziness, moodiness or grouchiness, anxiety or worry, headache, hunger, or inability to think clearly. If you exhibit any of these symptoms, if you move into the diabetic category and you exhibit any of these symptoms, you're going to want to call 911 immediately and get treated. If your signs and symptoms are not incredibly severe, you can actually treat them at home. I'm going to draw your attention to the handout entitled How to Treat Hypoglycemia. You're going to check your blood sugar, and if it's under 70, you're going to treat it. That's where the 15-15 rule comes in. You're going to use 15 grams of simple carbohydrates, which are 5 or 6 pieces of hard candy, 3 glucose tablets, 1 serving of a glucose gel, 2 tablespoons of raisins, 4 ounces of juice or regular soda, 1 tablespoon of sugar or honey, or 8 ounces of milk. Any of those individual options are available and have 15 grams of simple carbohydrates to treat hypoglycemia. You're then going to wait 15 minutes. That's the 15-15 rule. 15 simple carbs, 15 minutes. And then you're going to recheck your blood sugar. If it's still low, you're going to treat immediately and call 911. Okay? Next, I want to move to the handout titled The Relationship Between Type 2 Diabetes and Cardiovascular Disease. Okay? Cardiovascular disease is the number one risk factor for diabetes. But it's not the only risk factor. So on that handout, it says under it's not the only risk factor, being overweight, having high blood pressure, having high cholesterol, being a smoker, or having a family history of heart disease. So if you have those risk factors, you are going to want to take steps to control your weight, stop smoking if you're a smoker. There's a lot of resources for smoking cessation out there. And then control your blood pressure. You ideally want to keep it at least under 130/80, which is a blood pressure measurement, but ideally lower would be good. All right, now we're going to get into the fun part, the activities. So the first handout I want to bring your attention to is called Mismatch, and it looks like this. In this activity, you're going to pick out the item that doesn't belong in the group. So I'll give you a couple minutes to complete that. When you are finished, it should look something like this. Now, in this handout, I have circled instead of drawn in the box, but you can draw the fruit in the box. I'm just not much of an artist, so I chose the other route. All right. The next activity is called Food Safari. And on Food Safari, what we're going to do is look in this picture and try and find the items listed down here. I'll give you a couple minutes to complete that. But when you're done, it should look something like this. Circled, you will see all the items identified, and the little dot beside the name just lets me know that I have already found it. That is the Food Safari. Next, we are going to do the activity called Choose Your Food. And in this activity, you're going to take the items below and you're going to write them in or draw them in on the plate under the category which they belong. I'll give you a couple minutes. Again, I am not much of an artist, so I opted to write them in. At the bottom you will find listed down here, I have wrote in where they belong in the plate that is up here. So moving from this side across, we're going to put the drumstick in the protein, the bread in the starch, the banana in the fruit, the fish in the protein, the broccoli in the vegetable. I'm going with tortilla on that next one, and that's going to be in the starch category. The steak is in the protein category. The bowl of rice is in the starch category. And last but not least, the corn is in the vegetable category. Lastly, we are going to do a scavenger hunt. Around the rooms, you will find cards such as this one. The card is numbered at the top. This is card 1. You will find card 1 through 11 around the room. Card 1 through 11 is there to help you complete this scavenger hunt fact sheet. All the facts are in the cards as titled on the top. Cards 1 through 11 will give you the answers for the remaining questions and to fill in the blanks. Once you've completed that activity, please turn it in to me and we will move to the next portion of this presentation.